So, as Jenny said, I work within the local research network in Alder, and I also am based on the clinical research facility within the Trust. That's a bespoke ward which deals with research, clinical trials and clinical studies and supports those studies. So the aims of the network are to develop drugs that are both safe and effective in the treatment of children and young people. So why do we do research in children's medicine? Well, children are not young adults, they're not small adults. Their bodies behave differently to adults, and they also behave differently during their development as well. The way that infants and children and young people process drugs is also very different. This may mean that drugs may be more or less effective. Also means that dosing is very different as well. And it also means that there can be some side effects which may be seen more or less, or in fact on occasion new side effects are seen. Doing research in medicine also is a recognition that actual adult disease originates in childhood. So if we can pinpoint and actually start treating that, it may be that we can alleviate the treatment burden as when children and young people reach adulthood. It also, doing research in children also increases our understanding and actually can lead to ways in which we can look at preventing, diagnosing, assessing and treating diseases. So many medicines that we use to treat children are prescribed off-label or unlicensed. So unlicensed means that we actually use medications that may be licensed in the UK, but we use them for different purposes. Or they may not actually have a license in the UK, they've got a license abroad, which have obviously gained their license under the strict sort of standards which are done abroad, but we haven't actually licensed it yet in the UK. And this means that off-label prescribing, as it says there, happens when a medication is being used for a purpose other than what it is licensed for. So, for example, tablets. Some children cannot obviously swallow tablets. It might be because of their condition, or in fact they physically have a phobia against it as well. So we actually crush the tablets, mix them in water, and we can actually administer them via a nasogastric tube, obviously a tube which just goes through your nasal passage and down into your stomach. So that's using the medication in a different format. We also actually use treatments as well, which we use in adults, have been proven to work in adults, yet let's get licensed in children. So what that means is that we actually use them in children because we know they're effective, but we prescribe them at a lower dose. But essentially we're doing a bit of a guessing game there, it's based on weight, etc. And again, treatment is tested in children which may be licensed for a specific group of children in that disease area or a specific age, but we find that we might actually need to use that in another group of children in another disease group who are of a different age as well. So this is just a little slide here which shows that actually the use of unlicensed and off-label drugs in children is quite extensive. These figures are quite old, we're still working on gathering some current figures at the moment, but this is currently what we're looking at, and we're hoping obviously that these won't be the figures that we look at in the next couple of years. But what we work on is that 30% of unlicensed medication is used in primary care, 50% in hospitals, 80% in paediatric intensive care units, and 90% in neonatal intensive care units. And the neonatal group actually is actually looked at as a different subgroup as well, because we're looking at very early stages of childhood. So they are actually looked at as a different group as well. So our main aim really is to improve outcomes for children, because the use of unlicensed medications has led to a very high incidence of serious adverse events. So we're looking at adverse reactions. So the leaflet that you get in your medication when you get paracetamol or when you get antibiotics, the list of side effects that get put on there is what we're looking at there, adverse events, and these are things that were reported when we do our studies. And we also get serious adverse events, and that is when actually somebody's hospitalised because of an adverse event or reaction. So we also said there, increased deaths have been directly related to prescribing unlicensed medicine. So we can clearly see that there's a need for us to actually research medicine into children, because it's important actually to generate an evidence base for them, and an evidence-based approach based on clinical trials and other research is essential to ensure that we have improved these outcomes. So just a little overview of the research that we do. So as you can see, lots of specialist areas there: respiratory rheumatology, neurosciences, that covers the neuromedicines and neurosurgery, endocrinology, diabetes, gastrointestinal oncology, nephrology, renal, and the neonatal, as I said, another subgroup, and pharmacological immunology and intensive care. So, essentially, what do I do as a research nurse? So first of all, I'm a patient's advocate. So from when a patient joins the study, and even actually before that, we are involved with the patient in providing information to them, making sure that they are fully informed as to what a study or a trial or the research project consists of. Okay, so we make sure that they're given the opportunity to ask questions and that we actually provide them with the answers, if not directly from ourselves. We will seek that answer out and we will provide it to them. And as I said, it's all about them being fully informed towards the process of consenting. So that leads on to obviously recruitment, and again, you know, keeping patients and parents fully informed as to what they're signing up to. And also actually, you know, it's not about just recruiting them as well. If they actually decide not to participate and they've got sound reasoning behind that as well, we've done our job as well. We're not after getting the figures. Figures is good, recruitment numbers are good, but also we actually have to make sure that people know what we're doing as well. So it's all about engagement. We're also a point of contact for organisations, so that includes pharmaceutical companies, charitable trusts, academic organisations, organisations within primary care, GP practices, and schools as well, because the patients who participate in our studies, obviously the schools may need to find out more information if that will impact on their actual schooling. We're involved in local approval, so this is R&D setup, the R&D process. So study setups such as ethic approvals, SSI, so that's site-specific information, all leads towards us being able to do correct site implementation. So we're checking that the study which we're saying we're going to do is going to be able to be worked within our trust. Have we got the facilities to do it? Have we got the manpower to do it? Can we actually carry out the assessments that the protocol, and the protocol is basically our handbook, it's the guidelines which actually underpin every study, so each one will have its own protocol. And we make sure that we can actually, you know, deliver on what that study is asking us to do. Obviously, we're part of the clinical intervention as well, so we help do the assessments and the procedures. Some we will do ourselves, some we will do in hand with the medical teams. That can be blood sampling, urinalysis, that can be doing ECGs, that can be helping with respiratory tests and physio examinations. And all of this is actually to help collect and collate data. Because basically our study is only as good as the data that we collect. If we collect crappy data, then there's no point in us doing it, it's all been a waste of time at the end of the day. So we have to ensure that that data is good and clear and solid. And then we disseminate that data. Problem solving, well, we all do that on a day-to-day basis, but within the context of research, lots of studies require lots of visits. They can run over a number of years, and that's trying to incorporate that within the normal life of a child. Schooling, as I said, college for the older children. For the parents, it's about them being able to actually attend within their working hours as well. Some of the studies are very intensive and quite demanding. Some require overnight stays. Problem solving within that involves us trying to actually organise everything that's required, again, from the protocol in the study into that study visit. We have occasions when we actually have children who are needle phobic, so sampling, blood samples, or even in one study that we do subcut injections. We need to work very closely in trying to make sure that compliance is done in that study. So that means working very closely with place specialists, and they're very, very good at supporting the patient, providing them with distraction and providing them with taking some control over the situation as well. So we draw in other members of the team. And again, so that leads us to supporting trial teams. The trial team can consist of the medical team, the pharmacy, the pathology labs, radiology, physio. Again, it's the multidisciplinary team that you'll find in the hospital. We map progress, so we report, and as I said, all goes back to collecting the correct data. We make sure that we're on the right path, we're doing the visits within the order that they're required on the trial. And we report that and make sure that the company or the sponsor who's running that study knows where we're going, and we're clear on a clear defined path of what we're looking at. And at the end of the day, we publicise trials. So that's either going down to clinics, going to GPs, talking about research in school, or doing events such as this. But primarily, at the end of the day, children are at the centre of what we do. So we can't do any of this unless we actually have their involvement and their engagement in all of this. So there is a little video. Oh, how can I get this? which was done by the Arts for Health project in Alder. It was done to publicise the opening of the clinical research facility, which was actually only opened a couple of years ago. So I'll just pop that up for you.
Hello, my name's Vincent.
Hello, my name's Sam, and we're going to talk about
Medicine.
Well, I don't mind taking medicine, but if it's like tablets, sometimes I hate it.
Medicine is really nice, isn't it?
The tablets are okay, but they're quite big, but the liquid tastes horrible.
Paracetamol tablets I don't like because it's got like a very chalky taste.
I like Nurofen. It tastes like oranges. Do I look funny?
My new invention is called the super hot dog medication. You take it so you don't have to have any more nasty needles, tablets, so it tastes nice. You got like 2 different flavours. You got a nice yellowish banana tasting one that gives you all the medication, and then you've got like a tomato ketchup one which gives you an energy boost. It like makes you feel like there's more time to do things because you get things done faster with more energy.
I think most people would rather have a quick injection as opposed to having to be sat in a hospital for ages when, for example, if the sun's shining and it's a beautiful day and you're sort of just stuck in here getting intravenous and having to sit here for hours on end, and it gets old quite, and having done this for 6 years, you would just want something that'd be quicker and more efficient.
ready to attach you, Ryan.
If the energy ever runs out, you can get like these samples, so you don't have to take the whole hot dog again, you just get this like package and just like squirt it in your mouth like yogurt. So I think it's the best medicine that the world will ever see.
If I made my own medicine, the side effects would be
It could make you fly,
I could fly,
and then you could fly all around the hospital.
I could make Mum get me whatever I wanted,
Seeing different people
for a day.
Make you have nice skin and
you could make them feel better by chatting to them.
It wouldn't taste horrible because it tastes like your favourite sweet. Yeah, like a pick and mix bag of sweets with all the sweets mixed together in one medicine.
God, that'd be fantastic.
If I could see the future for the hospitals or medicines, I would see it as everything being machines. People being robots. I know that sounds weird and it won't go, but still have their emotions. There'd be robots looking after the people. Medicine wouldn't be given through IV either. It'd be given through like a drink where you can just drink a litre or whatever. Like nurses and everything would be robots. People wouldn't have to work because of it. They can just be rich and sit back and do whatever, but the robots will be doing everything. Surgery would be like a 10-minute thing, so you're in and straight out, and you wouldn't realise you've been in surgery or anything.
I'm in this hospital right now. I'm in the cupboards with all the toys.
yeah, when I was little, Mum used to almost have to force me to take medicines because I didn't like the taste. Well, apart from Calpol.
I want to help the other people who take horrible medicines, and they can have the nice medicines with me.
And then when I started to move on to tablets, I could only take ibuprofen again because it was sugar coated.
And I wish I could invent my own medicines.
But like if a girl was sick, it'd be pink or like red, and if a boy was sick, it'd be blue or green.
I want banana medicine.
It wouldn't have like side effects like
Apple medicine. Strawberry medicine.
And it'd have to be a nice round shape or like an oblong.
And chocolate medicine. Every flavour you can get them in.
It's an oblong like a circle but long. An oblong.
Just invent them for me, please. Please. And I wish I didn't feel sick all the time.
one side effect would be good if it just literally put you to sleep straight away. It make you more like not tired anymore. While you sleep, you're dreaming and you're in your own little happy world. And then when you wake up, you still think you're in your happy world.
Oh, yeah, you could eat, if you had celiac disease like me, you could eat a chocolate cake and not be ill at all.
Well, that means you could eat proper food for once.
Yeah, you could eat proper food.
You feel like a new person, very happy, jump up, just jumping around, running, yelling, ah! And just be very happy for a whole day.
You could get whatever you want, and if you were too hot, you could be cold whenever you want, and if you were too cold,
To give you psychic powers.
One other side effect would be good if I could get my dad to give me pocket money every day.
yeah.
After taking this magic medicine.
Wish you had a better day and a better life. Make people better, make them healthy, make them happy. Just help me, make
We
them
nearly finished, haven't we?
No, just make them go round and round. Make them better, make them happy. We'll do anything for them. You can do anything for us. We'll do anything for them.
Nearly finished, can we?
Okay, so you can see we have a few challenges there. Some people, obviously, side effects and adverse events are not desirable. There are some very desirable side effects which they would like to see. This leads us very nicely actually onto an event which was called, seem to have lost the thing. Generation R. Now this was an event which was done with the seem to have passed on. There you go. I didn't realise it did that. So, Generation R was an event which was organised by the Medicines for Children Research Network Young Persons Advisory Group, the group which Jenny is very heavily involved with. And their statement there basically is that young people improving research. Now, this group work across a range of studies and look at different types of research. The event was carried out on the 11th of September last year, 2013, and it was, as I said, organised by the children, young people and their parents, supported by the MCRN staff. Their main objectives were really to demonstrate how children and young people and the parents could support and improve the design and feasibility of studies, So why are we doing the studies? Do we need to do the studies? Are we looking at the right questions? Are we trying to find the right answers, basically? Also looking at the right, looking to report the right patient outcomes as well. So it's about informing them of what's happening during the study, giving them the right information. Even actually, you know, there's a reluctance to actually report negative information, but that's all very helpful in the process of actually doing research. You know, that we need to find out what's going wrong as well as what is going right. Also showing how patients and researchers can obviously come together to improve research itself. So this event, I believe, was oversubscribed, but we had 150 delegates representing different organisations within industry, charities, trusts, and from the National Institute for Health Research. Esteemed guests were Professor Dame Sally Davis, CMO of England, and Dr. Jonathan Sheffield, CEO of the NIHR Clinical Research Network, as it will soon to be known. A list here is of the activities, again, which were all planned by the patients and the parents, it was the main requirement was for it to be very informal. So those who attended, it was a no-tie event, very casual clothing, and just to have a very informal feel about it so that people could feel relaxed and obviously engage in the whole event and be enthusiastic about it. So the main reason for us to be doing this, obviously, is, as I said, engagement and enthusiasm within children, young people and parents in research. Was also looking at demystifying the whole actual idea of research. We want to move away from the whole mad professor idea. We want to move away from the, you know, mad scientists in labs over Petri dishes, locked away. We want it to be transparent. We want people to be involved and understand what actually goes into the research. So there, as I said, it's all about being informed. So another quick little vox pop here, which we have, and you know, we're talking about children having an understanding of research, but you know, we're looking at this as well from a perspective of what do actual grown-ups think about research as well. So this was just a short vox pops.
Brilliant, yeah, because that's you're our future.
I think it's good that children could take part in medical research.
No, but I suppose it's necessary.
I don't think I'd let my child do a research trial. That's me.
No, that's just me.
Depends what it's for, and it depends kind of how invasive the research is.
Well, I know that children's and adults' bodies are quite different, and the effect of drugs on them can be quite different too. So there are always risks, but sometimes maybe you've got to take the risks in the interest of a greater advancement.
I think subject to health and safety regulations, I think it's okay, but obviously there's limits as to what's acceptable, I think, yeah.
I think it's really controversial. It'd have to be up to the parents and the children themselves. I don't think it can be a complete across the board. I think it'd have to be up to the individual children and the parents themselves.
So we're talking now, that's the adult's view of the research. So, you know, if this is a sort of information and idea of research that is going down to children, then we're obviously facing a battle from that point of view. So, from the event, there were 3 significant topics which the delegates were asked to discuss and feedback on. First of all, one of them was the ethical challenges of paediatric research. The second one was disseminating research results. So how do we get that information out there and let people know about, you know, the results of these studies that we do. And secondly of all, it was about looking at the future of research and educating the next generation. So from that, we've obviously got a list of recommendations which came out of that. So, you know, they go from working with key stakeholders, so working with parents and young people, and collaborating with organisations such as the Nuffield Council and the Royal College of Paediatrics and Child Health. And they're looking to identify solutions and tackling some of the major challenges of participating in research and actually organising research. Again, it's about making information openly accessible to the public throughout the stage of a study, not just at the end of it. If you're involved in it, you want to know actually what's happening with your information and letting that information go out and inform all those involved. Feedback as well, and looking at making sure that the research is peer reviewed as well, because we need to be quality assuring all along the way as well. Looking at alternative and innovative ways of engaging with more young families. So we're looking at sort of things like social networking and looking at different media formats as well, online resources. We have there as well that the Medicines for Children Research Network PPI workstream are working closely with the actual industry group and looking at models of closer collaboration with pharmaceutical companies, because one of the big issues is actually bringing pharma in to do more research in children. It can be expensive, at the lot of work for very little gain, to be honest with you. Their main focus will always be on adults, so we're trying to bring them into doing more paediatric research. And looking, obviously, still always looking and focusing on the involvement of young people and families, and identifying and prioritising research studies. We could be saying this is what we need to look at. There could be a complete area that we're missing out on, and we need to know that. So, as I said, if the children are experiencing it, then they're the ones who can let us know about it. Looking at developing effective communication strategies, so things like Generation R, these websites, these events, they have a website, e-magazine, and as I said, using social media, Twitter, Instagram. They're the only ones I know, because I'm not that how genned up on these sorts of things, but I'm sure most of you will know more than me. And obviously working with the education sector. It's about educating and bringing that education and knowledge of research into schools as well. As I said, the main point was to demystify the whole concept of research. These recommendations and a report on the whole event were presented to Dame Sally Davis on the 6th of February this year, wasn't it? Again, this report just put forward the simple message that young people should be involved in research and can greatly improve it. And on the day, it was reinforced by the delegates who attended, and again by the children and young people and the parents who attended. And it was looking to get everybody involved, as we say, and the feedback and ideas taken from the event. We got a tremendous amount of enthusiasm and support for this. So, at the key end of it all, I think collaboration was paramount on the top of that event. And, we're looking to go forward from this event now and use this as a springboard, I think, really, to look at all the different organisations and bringing them in there. So there's a couple of hard copies of the report there at the front, but the link there will take you straight onto the report, and as I said, the recommendations will all be listed within there, but it also has interviews with the people who attended, and the thoughts of Dame Sally Davis and Dr. Jonathan Sheffield and Simon Denegui. He works for the public awareness in NIHR as well. So just to quickly finish off, probably overrun a little bit, there's just one more little video which was done by a couple of patients within Alder and Great Ormond Street Hospital, and it just gives a little idea of what they do within research and what they're involved in.
Thousands of children around the world are relying on Siobhan and Esme. Doctors and scientists will struggle to make a breakthrough without them. New research can't progress without children like Siobhan and Esme. Why? Because children like them have power. The power to change the lives of other children. The power to nurture medical breakthroughs. Who are these children? Ordinary children doing extraordinary things.
Hello, I'm Esme.
Hello, I'm Siobhan and I'm 13 years old.
I'm 16 years old, and once every 4 weeks I came here to Great Ormond Street Hospital to take part in a medical research study.
Once every 2 weeks I come to Alder for a few hours to take part in a research study.
I meet the team who look after me and we go to the research room where I have my treatments and tests.
Children are really vital to clinical trials because we can't take data from adults or other groups, and so it's only by involving children of the relevant ages, including newborn babies if necessary, that we understand how medicines work in that age group.
We are totally indebted to children like Siobhan and Esme who take part in clinical trials in centres like Alder and Great Ormond Street. Without their selflessness and their altruism, we would never learn how to use the medicines properly or safely.
When children come into their study visits, we try and ensure that the clinical research facility is like a home from home for them. So we make it as comfortable as possible. They're allowed to bring in their own toys, and we also have facilities here such as TV, PlayStations, which basically make the time pass, hopefully, as quickly as possible for them.
I think children helping other children is really inspiring. They're coming here, giving up their free time to make a difference.
Thousands of children, just like Siobhan and Esme, volunteer for medical research. In doing so, they improve and save the lives of other children.
I hope it might help me with my illness.
But I also want to help other children so we all have better treatments.
Ordinary children doing extraordinary things.
So there we go. Just an example of two of our patients who work with us on our studies. So, if you want to know more, that's our details. So there's Jenny's details on there as well. She's our consumer liaison manager, and there's my details on there. If you need to find anything more or I'm not available, then we also have research@alderhay.nhs.uk, which is the email for the research business unit, where you can contact any of our colleagues. And if you ever want to come and have a look at our clinical research facility or what we do there, you're more than welcome. And there's some of the links of the organisations which are involved within the presentation itself. So, thank you. Sorry.